my back went out. Oh my gosh, what do I do? Do you have back pain on your right side, left side, or even right in the center of your lower back? Well, let me show you what I do for my own pain and what I've been doing with my patients for years to not only get rid of the pain, but to keep it gone. So not only is this video going to help you get rid of your current pain, but it's going to give you a bonus. It's going to teach you how to prevent it from happening in the future. If you're over 40 like me, the vast majority of times your back is going to go out, it's because you picked up something light and simple like a little weight or your kid's toy off the ground or a pen even, and you didn't pay attention to how you bent. So we've got a sock on the ground. I've heard this numerous times from patients. Doc, all I did was bend over to pick up a sock off my floor and my back went out. Oh my gosh, what do I do? Well, number one, we've got to learn how to bend properly. Remember that point right there, because we're going to talk about that at the end of this video. Number one, if your back just went out or it hurts from going forward, the last thing you want to do is bend over to start stretching or lie on your back to start stretching. You have an injury related to what's called a shift or a buckling. Stretching will not help that. Check this out. Let's get right into what's going to help it. Okay, so if your back just went out, or if your back is really tight and it's not acute, stop bending over to try to stretch your back. That's only going to give you temporary relief. What I want you to do is I want you to get to the floor and I want you to restore the normal curve in your lower back that is here when you stand. It's called lordosis. Remember that word. So the first thing we're going to do is get down into this position and just hang out. By doing this position, right now, my brain thinks my spine is very safe and it's going to stop sending signals to my lower back to freak out and get tight and cause muscle spasms. The reason your back is getting into a spasm is because you bent over and you buckled that spine. You overbent it. So the brain went, oh no, it's going to break in half, and it locked you into a spasm. So the last thing you want to do is reintroduce that motion. So we're going to get down here. We're just going to hang out here. If this is too painful, we're just going to start right here and just hang out here a couple of minutes. Then when you can stand it, we're going to go a couple minutes right here. Then when you can stand that, we're going to go up like this, do 10 or 15 reps, and see what feels best. We're going to find what we call position of preference. For me personally, this is my position of preference. If I cross my leg and I push up, I feel that more on the right side of my lower back. So that's pushing one of my bad discs back in. If that doesn't feel good for you, then you need to cross your leg this way, and maybe that's your position of preference. If you get some relief, let's do a couple of rounds at 15 to 20 reps, just like this. If your arms get tired, rest back down in this position. Pretty simple. That's step number one. Now, step number two, once that spasm has subsided, or again, if you're not acute and you feel a little better, let's keep the back in this curve, which is lordosis, and let's come up. And let's get into a very nice, simple quadruped. Now, we're going to just do a little bit of lower back range of motion just to find where neutral is. This is where we do not want to be because it's too much extension, and this is where we don't want to be because that's too much flexion. And in this case, this is what caused the problem. So let's get into a comfortable position where we have no pain. It's usually going to be somewhere in this range. You should be able to put a tennis ball or golf ball in the small of your back and it should stay right there. Now what we're going to do from here, push away from the ground, focus right here in between your thumbs. We're going to go right arm, left leg, and we're going to hold that for 10 seconds. Bring that back down, make sure the spine stays neutral and it's not swimming around because as soon as it starts moving again, it's going to hurt. Keep it locked into that good position. Tighten your core a little bit. Left arm, right leg. Feel the glute contract. Hold for 10 seconds. We're going to repeat that for several reps per side, holding each one for 10 seconds until you get tired or until that back spasm or the tightness starts to subside. Once you are feeling better, we got to get back up onto the feet. So what we're going to do is keep the spine in a neutral position. Walk the hands back to the knees. Now, I just spent all that good time telling my brain that everything's good with my back. So if I try to get up like this and I go back into the position that originally hurt me, the back is going to spasm again because the brain thinks it's in trouble. So you've got to remember, when you get up out of this position, keep lordosis. walk backwards, get nice and straight, a little bit of core tightness, one leg, stand up. Now we're feeling better and we're ready for move number 3. Now that you're upright, you're probably gonna feel some tightness in your back. So I want you to go for a walk. Let's just walk around the house, go around the block, get nice and loose, get into some nice strides. The reason we wanna walk is because it puts the lordosis back into the spine, it gets your glutes firing, and it gets us into a more normal position. If you still feel tight, I don't want you to bend over to touch your toes. I want you to start introducing stretching to the spine, but not to the area that was injured. We're actually going to stretch the thoracic spine, which is a little bit above where the injury is. So if you're a little bit hurt through here, we're going to stretch up through here. So now, if you're still feeling some stiffness, we do want to introduce some stretching. This is the way you hurt your back, so we don't want to stretch it that way. It's going to send freak out signals back to your brain, and it's going to retighten those muscles. So what I want you to do is take something that's about this height or can be even a little lower, like a kitchen counter or the back of a couch. Put your hands like this. Step back like this and get a really wide stance. Now what you're going to do is push your rear end back, and what I'm going to do is I'm going to take my head and my armpits, I'm going to push them down towards the ground as I push away from the structure. What this is doing is it's creating a hip hinge and a tractioning of the spine and a stretching mechanism to some of those muscles and joints that are kind of freaking out a little bit. So all I'm going to do is push back this way, nice wide stance, drop my head between my arms, butt back there. I got a nice stretch in my spine. I'm even getting some lat stretch. I'm going to hold it for a couple seconds. I'm going to come up and I'm going to spend about a minute or two in this position. Now, once I'm done with that, I'm going to straighten up. I'm going to put my thumbs into the small of my back. I'm going to squeeze my butt. I'm going to lean back and pick a spot on the ceiling behind me. I'm going to do this about 10 times, and that's going to restore normal function to the joints and to the muscles that are freaking out because I bent over. So spend about 2 or 3 minutes alternating between those two movements, and then let's move on to the next. Now again, because this is a bending over injury, we don't want to stretch the spine, but we have to move. So we've got to stretch the glutes and the hip rotators because that is what allows for proper motion. In the absence of good glute flexibility, you're not going to be able to bend your hips and you're going to have to move through your spine more. So all I want you to do is find a bed or a couch or a bench, sit down like this on an angle. Contrary to what you'll see in other videos is we don't want to collapse the chest down to the knee because remember that forward bending is what caused the injury. Let's get on an angle. Let's keep the chest up so we keep that lordosis. Bring this leg here, this leg back. Now this leg back, you're going to stretch the hip flexor, squeeze this glute. Now grab the bench, keeping your chest up, and try to get your sternum, which is your chest bone, over your knee this way. Pull yourself in till you get a huge glute stretch. Keep this glute contracted. Take 10 deep breaths. Come out of it. Repeat that 2 more times on this side, and then switch sides. Now lastly, and arguably the most important points to this video are learning how to not hurt your back again. So when you have to pick up that object, when you have to pick up your kid, I want you to remember 2 things. Core tension, okay? Just to make sure that your spine doesn't buckle. Tighten your core muscles and poke. You should have some hardness through here, even if you got a little fluff. Push through there. Don't suck your belly button back. Tension your core so it's hard. Number 2 is when in doubt, stick your butt out. Push your butt back this way, then bend your knees, and that's going to teach you to do a perfect hip hinge. So no matter if the object is heavy or light, tension your core. Get your belly button right over the object you're going to pick up, whether it's your kids or a heavy kettlebell. Hinge your hips back, keeping your back in lordosis. I don't like it when people say flat back, because flat back means your back is flat. You don't want a flat back. You want a little bit of lordosis. I'm in lordosis right now. I'm going to tension my core to lock that into place. Then I'm going to push my hips back. I'm going to feel a hamstring and glute stretch, not a back stretch. If you feel a back stretch, that's your back moving and you're going to hurt it. Tension, hip hinge, little bit of knee bend if you want, and then right now, I'm only using my glutes and my quads and hamstrings to pick this up. Even if it's a lighter structure, like a sock that threw the back out in the first place, remember, hip hinge, tighten your core, pick it up. If you can't get all the way to the ground, do it like a golfer. Hip hinge with one leg and pick it up that way. If you need some support, put your hand on your leg and kick your leg back this way. Remember, hip hinging with intra-abdominal pressure or a core brace is going to bulletproof the system so you don't hurt your back. So if you enjoyed this video and you learned a lot, please don't forget to like and subscribe, and check out the link to our community down below in the description where you can get lots of great information on more subjects like this, like back pain, knee pain, shoulder pain, you name it, even fitness stuff, nutrition stuff. We've got tons in our community. It's going to help you feel better, get you out of pain, and most importantly, get you better, not older.